Hi, I'm Maggie Griffith, and this is my assessment 1 for reflection on collaboration and leadership. In my previous job as a hospice on-call nurse, my role was to support around-the-clock phone and in-person help from 4:30 p.m. Friday until 8 a.m. on Monday. I worked a 63.5-hour shift each weekend. When I accepted the position, it was not the first time I worked as an on-call nurse, but I was told by my new employer that the burnout rate was high for them and that management was working to convince corporate that 2 full-time on-call nurses were needed. I appreciated that management realized the demands and bouts of sleep deprivation with the position, requiring a second nurse to provide better balance, safety, and sustainability. The position was approved, and I was allowed to be part of the interview process. My nurse manager and director encouraged me to meet with a prospective candidate and allow them to have a Q&A session with me about the reality of on-call. And they also followed up with me after I met with that candidate to ask how I felt about them. They allowed me a candid and honest conversation on my first impression of someone I would be working very closely with. They valued my feedback and felt that the candidate was a good choice, so she was hired. I grossly underestimated, moving forward, how difficult it would be to divide a position that I was used to being solely my responsibility. And my nurse manager, on top of that, chose to have a very hands-off approach. She told both of us from the get-go that we were both professionals. She didn't want to micromanage who would cover phone calls or do visits. So she and I, my coworker and I, were left to trial and error and voice our opinions solely to each other on how we thought things should be done. Management had told us they didn't care how it happened as long as all calls and visits were handled. That, at times, especially as our territory grew, became kind of a gray area and the source for stress and some confrontational moments between myself and my coworker. The experience definitely taught me a lot about finding a balance between overcoming my fear of upsetting someone. I'm very non-confrontational, but I think some of the things that were upsetting me that built to higher stress levels could have been alleviated or better handled if I had found more direct ways to tell my coworker when I had concerns with how things were being divided up. I also feel that some structure and involvement from management could have taken off the pressure of the on-call staff to have to make all the decisions on their own when taking what was one position and dividing it into 2, that we could have used some more guidance from leadership. With Villa Healthcare, according to the administrator's account, there was no collaboration on which kind of software should be used, just simply that he was told of a software company that could be used due to a company discount. This is one example of where saving money on paper can actually be a financial loss in the long run, especially with possible turnover of staff when a new process implementation goes poorly. The administrator's voice was not heard that it wasn't a hospital system and wasn't a good match for a skilled nursing facility because of the differences in how things operate with a hospital and a skilled facility. Another problem that seemed to be complained of by administration and everyone else in the Villa interviews was the implementation coach, someone who wasn't a part of the team coming in and making that biggest impact, having the most say, the most control, and then not being a permanent fixture there. The director of operations acknowledged that collaboration was important, but voiced that it was next to impossible to create the foundation of teamwork and support with that rushed timeline they were given. The IT manager also voiced that he and his team were not given a platform by the implementation coach to be a part of things and that their experience wasn't valued. The nurses also shared that feeling of things being rushed and with no value to their input of what parts of the EHR would benefit them the most. They also experienced that trickle-down effect of IT being mad at the coach and taking out on the nurses by offering as little help as possible to the nursing staff. There were also collaboration issues among the nurses, as some were more proficient than others, but only offered a sink or swim mentality to nurses that said they were struggling or stuck. In their research from 2015, Tara, while writing about trying to organize interdisciplinary rounds, said that poor execution of vision, training, rollout, structure, and monitoring can render ineffective and create a disorganized approach that is difficult to get back on track. I chose to include that comparison of how poor planning can have an effect because it is very similar to the current state that we find Villa in during everybody's follow-up answers. McKinnon et al., as cited in Liu et al., writing in 2016, noted that despite the importance of interdisciplinary collaboration, that difficulties in team communication had been reported because each health professional holds a different set of values about teamwork based on professional socialization, personal experiences, as well as differing belief and values. And I think we really saw that between the nurses and the IT staff. So looking at leadership and what they could have done to improve things, Shirey in 2017 wrote that when leader-member engagement is evident, that nurse cynicism decreases and job satisfaction increases. These findings support the importance of unit-level leadership to cultivate empowering relationships conducive to creating a positive work environment. This source was included because one logical solution for improvement in relations with leadership is to have an IT champion nurse as part of a unit-based council, allowing them to work with IT, allowing them to have that open door to management to be an advocate when there are IT-related issues causing conflict and patient safety issues. In the case for Villa, of vitals not being entered or medications being missed. To pretty severe consequences for patient safety. Tara also supported the need for multi-level involvement approach with innovations, again comparing with rounding in a hospital, saying that leadership by both an executive champion and a clinical team facilitator is integral to that being effective, and that weak, unwilling, or unsupportive leadership results in poor outcomes. And that was really evident with the IT manager admitting to telling his staff that they could do the bare minimum as a way to try and balance that power struggle that they were having with the implementation coach. As far as interdisciplinary collaboration, coming back to paraphrase Shirey again, that for work environments to be healthy and productive, certain elements must be in place, and there's evidence that affirms the value of supportive structures, access to resources, and ongoing developmental opportunities. As that relates to Villa, there wasn't much support from the implementation coach. And when he was done training, he went back to Boston, and there wasn't really a resource for the nurses to reach out to. Using someone that already worked there to try and make a champion of the new program could have been very beneficial, to have that point person that if, when a nurse is struggling and another nurse is too busy to really help them and doesn't really have solutions, having somebody that they know they can go to with issues about a new program to try and overcome that, move forward, and grow. That could have been beneficial. And there also weren't any additional in-services or developmental opportunities for staff to speak of to help them grow and work together to find ways to make that EHR as functional as possible. Overcoming the fact that even if it wasn't ideal and there wasn't much say in what software they had, just providing more follow-up and more opportunities for staff to work together through that instead of it being divisive. So in conclusion, after reviewing some of the many leadership and interdisciplinary issues or areas for improvement that Villa had, and sharing one of my own experiences, I hope that my reflection and my research on leadership and interdisciplinary collaboration provides some clarity towards solutions. Thank you.